Hello, I'm Dr. Frita. I'm Dr. Frita Fisher, and thank you for joining us for our first YouTube Live. I'm here at my office in Emory Midtown with my practice manager, Shador,
Hi.
and we will be taking your questions as we talk about kidney disease. This is March, and it is Kidney Disease Awareness Month. In fact, it is World Kidney Day today. Kidney disease is really something. It affects 1 in 3 people. 1 in 3 people are at risk, and over 30 million people in the United States actually have some form of kidney disease. 700,000 people have end stage renal disease, meaning they either qualify for dialysis or for transplant. And of those people, 75% have diabetes or hypertension. Diabetes is the number one cause of kidney disease. Hypertension is the number two cause. So, two very preventable diseases have so many people on dialysis or in need of transplants. Transplants are really important because one in one person dies every 2 hours while just waiting for a kidney transplant. So at this time, I will take a break from giving that overview of kidney disease and take some of the questions that are coming in.
Well, before we get started on the questions, Dr. Fisher, can you kind of go through the different stages of chronic kidney disease?
Sure. There are 5 stages of CKD or chronic kidney disease. Stage 1 is the best stage, where the kidney function is at 90 milliliters per minute, or kind of like 90% or better. Okay. For stage 2, the GFR or glomerular filtration rate is between 60 and 90. For stage 3, that GFR is between 30 and 60. And then when that GFR is between 15 and 30, you're at stage 4. And if it's less than 15, that's the lowest percentage of kidney function, then you're at stage 5 and you are in qualification for either dialysis, renal replacement therapy, or a transplant. So there are 5 stages of kidney disease, and it's important to talk to your primary care physician to find out what stage you're in. And you can find that out by a routine blood test called the serum creatinine.
Okay, we have a question from a viewer, Canibre. Okay. Oh, I'm saying that correctly.
Hi, Canibre.
He said, "Hi, I watched you and learned about internal lupus. Could they infect my kidneys?"
Absolutely. That's a really good question. It absolutely can. Lupus can cause something called lupus nephritis, or inflammation of the kidney cells. And there are different stages of lupus nephritis. Lupus is very common among African American young women, Hispanic young women, and men can have it as well. In fact, the celebrity Nick Cannon has been very open in sharing that he is living with lupus. And some other people like Selena Gomez, the singer and the actor, has lupus nephritis, and she actually developed end-stage renal disease, and she has now had a transplant and is doing well, as far as I know, with her transplant. Some other people you may have heard of, like Gary Coleman, has it, but his is not from lupus. Fried antibodies in your body. Instead of attacking the bacteria, viruses, and germs of the outside world, those antibodies turn against you and start fighting your own body. That's what happens. So in lupus nephritis, actually attack your kidney cells and cause your kidney function to decline. This is something that is potentially preventable and treatable, but you must be seen by your primary care physician and by your rheumatologist, your lupus doctor. And if you do develop lupus nephritis, there are medications and some lifestyle adjustments that can help. And ultimately, your nephrologist, a kidney doctor, such as myself, can help to treat the lupus nephritis. So good question.
All right. From viewer Eric, what symptoms should I be aware of that may suggest I may need to visit a specialist?
Okay, that's a good question, Eric. So as far as the symptoms for kidney disease, here's the tricky thing. Early on in kidney disease, the body is so good at compensating that you may not know that you have any kidney problems at all. That's why even before you have any symptoms, it's important to see your primary care physician, because that primary care physician will check that serum creatinine, the marker for kidney disease. And so even if you are symptom-free, if that creatinine is off, then your doctor can help to try to prevent further decline of the kidneys. For most people, a normal serum creatinine is around 1.0, 1.0 or lower. The lower, the better, because when the kidneys are getting rid of creatinine, we know they're also getting rid of the body's the other toxins, the other poisons. When the creatinine is high, certainly when it's up above 5.0 or greater, that's the time when many people may actually need dialysis. So even before having symptoms, you need to be seeing your primary care doctor. That doctor will also check to see if you have any protein in your urine, which could be a sign of kidney disease. Now, some of the kidney can be some swelling, like holding on, retaining fluid. Your kidneys are responsible for filtering out excess water. So if they begin to do poorly, to fail, then you may have swelling in your feet, your ankles, maybe even swelling around your eyes. You can also feel fatigued if you have anemia, because the kidneys are also responsible for helping you to make a certain hormone that promotes red blood cell production and helps to prevent anemia. So fatigue or anemia can be another symptom of kidney disease. You can also get short of breath, not only from the fatigue, but if you start to retain fluid in your lungs. Your blood pressure can go up. But again, by the time you get symptoms for kidney disease, it's a little late in the game. So you should be preventive, stay ahead of the game, see your primary care physician, and ask to be screened for kidney disease.
What are some of the things that can cause kidney infections, or would Lyme disease be one of those causes?
So there are all kinds of things that can cause kidney infection. Some of the more common things are the bacteria that just live on our bodies, our natural flora. Everyone, no matter how clean you are, no matter how many baths you take a day, you have bacteria that live on your body, and it's normal. So some of the more common bacteria that can cause kidney infections are E. coli, something called Klebsiella pneumonia can cause it, Proteus mirabilis can cause it, mirabilis, and are things that we just have in our body. Some things that we can do to help prevent kidney infections are when you use the restroom, when you urinate, especially ladies, you want to wipe. If you wipe from and you act from your rectum on the tissue and then wipe front, well, now you're feeding in fecal bacteria right there at your urethra, right at your urine hole, and that can make you have infections. The other thing that's important is making sure that you use the restroom when you need to. A lot of us don't like to have to get up and keep using the restroom or disrupting daily life, but it's important not to hold the urine because that can promote urinary tract infection. There's also something called honeymoon cystitis. That's when classically newlyweds, especially females, might get urinary tract infections. It's important that after you have your marital relations, I don't know what all age groups are watching, but ladies, urinate right after to make sure you get rid of any bacteria that might be sitting there.
Okay. Viewer Mama Moore, she has more of a natural approach. Are there any natural approaches to help treat kidney disease or prevent it, such as herbs or a cleanse?
Okay. So some of the natural things that you can do, staying hydrated. And again, you want to talk to your primary care physician so that you know the right amount of water to drink. For most people who have hearts that function well and who don't have liver disease, drinking between 2 and 3 liters of water a day can be helpful. Why? Because it flushes out the kidneys. So if you have debris or if you have bacteria that may be sitting in your bladder, if you're drinking a lot of water, then that can keep that urine flow up to help to get rid of it. Something else, cranberry juice. So I know a lot of people think that's kind of a myth, but if you think about how gritty cranberries are or how gritty cranberry juice is, it's the resin in the cranberries that can help to attach to bacteria so that when you pass that cranberry juice through your urinary tract infection, through your urinary tract, you also pull out some bacteria. So through drinking cranberry juice, as far as herbs are concerned, I'm not sure of which herbs are actually proven by any type of a randomized controlled trial to help with urinary tract infections. But some of the things that have been proven are cranberry juice, drinking water, and definitely if you're feeling like you have any symptoms, you want to see your doctor.
Okay, great. Your next viewer, Jennifer, she actually have a question about kidney stones. She said, I have kidney stones, which causes so much pain. She did 7 surgeries or literacy to break up stones, but now are still suffering. Is there anything that she can do?
Okay. Hi, Jennifer. I'm sorry you're going through this. So she's had 7 stones. You've had 7 stones. Okay. So the lithotripsy you've had, That means that you've had a urologist to go in and to use some type of an electric shock to break up the kidney stones to make them small enough for you to pass them. That is one of the actual preferred procedures. There are some other procedures, ureteroscopy, where there's a camera that goes through the urine hole, the urethra, and it goes up into the bladder. It looks in the ureters if the stones are there, and it can help to retrieve stones. And then if your stones are really that difficult to remove, then at times they actually have to do an open surgery where they go through your back, through the flank where the kidneys are, and they actually do a surgical incision and they remove the stones. So it sounds like you have really some recurrent stones, which is an issue. The thing that is concerning to me is what's causing the stones. In my nephrology practice here at Emory, I focus on kidney stone prevention. Now that you've already had the stones, and most certainly you need to keep following with the urologist. But in kidney stone prevention, we need to find out why you have them. So the next time some stone fragments are removed, they need to be analyzed to see if you have calcium oxalate stones. Do you have uric acid stones? Do you have cysteine stones? And then why do you keep getting the stones? Are you dehydrated? If you're drinking less than 3 liters of water a day, then you may have certain particles or substances in your urine that are just sticking together, making you predisposed to keep forming stones. So making sure that you're very hydrated and then analyzing the stones to find out what in the world is in your stones, what's causing you to have them. You need to find out if you are hypercalcemic. Do you have a lot of calcium in your blood? They need to check your parathyroid hormone, because if it's found that you have hyperparathyroidism, glands, the 4 glands in the corner of your thyroid, if they're causing you to have high calcium, then that could be so if you get that diagnosis, which is treatable, then that can help to prevent the recurrence of stone. Also, do you have gout? Have you had a gastric bypass surgery? Are you someone who has Crohn's disease or some type of an inflammatory bowel disease? These are different things that can predispose you. And so beyond treating the stones, which you definitely need to do, we need to get to the source of the problem and find out why the stones are recurrent. And definitely find out what your primary care physician thinks, because you may need a referral to a nephrologist in addition to a urologist, because a nephrologist like myself would go through and help to analyze to prevent you from getting the recurrent stones. But at this point, since you have had the physical stones there, which clearly and unfortunately have been difficult to remove, I would absolutely follow back up with the urologist and find out if some of these other procedures will work for you. And then please see your primary care physician and possibly a kidney doctor, nephrologist, to make sure that you don't keep getting the stones. Thank you for that question, and I wish you the best.
Oh, great explanation, Dr. Fisher. I would like to remind the viewers to remember to like the video, share the video with your friends, your family, and anyone who may be interested as well. Zion wants to follow up with the kidney stones as well. He has 2 large stones, and it's to have stents put in afterwards. Does this prevent from stones from forming again?
Good question, Zion. That's a very, very good question. So what the stents will do after you've had the stone removal is they'll help to keep that tube between your kidneys and your bladder open. So you have, go ahead.
And I'm sorry. I'm sorry.
Zion. I'm sorry, Zion. And and I have a little baby cousin named Zion, and who's a female. Hi, Zion. Sorry about that. So your kidneys. So you have your 2 kidneys, which are located where the love handles are in your flanks. And then there's a tube that comes from each kidney, a ureter. The ureters go forward and down in your pelvis, and they each join the bladder. So when you have stents placed, oftentimes it's in the ureter to keep them open. So once you have the kidney stones removed, if you have any kind of scarring, or if you have a tendency for those ureters, those tubes to stick together, then those stents will help to keep the ureters open. They'll help to keep that urinary flow open. What they do not do is that they do not prevent kidney stone formation. They may help prevent you from getting blockages, but they don't prevent kidney stone formation. To prevent kidney stone formation, that's when you need to follow up with your primary care physician or even a nephrologist to, again, have that urine analyzed, to have the pH of it analyzed, all the different substances, sodium, calcium, to do a workup of you to see if you have hyperparathyroidism or some other illness that predisposes you to stones. That's what will actually prevent the kidney stone formation, in addition to being well hydrated and having a low salt diet.
Wonderful.
Thanks for asking, Zion.
Is asked, why does kidney disease seem more prevalent today than years
That's
ago?
a very good question, Ms. Inez. It seems more prevalent in today's society for a variety of reasons. One, when you know better, we're doing actually diagnosing the kidney disease. It's been out there for years, for centuries, and had the tests that have like the other thing is if you have there really wasn't a lot of options. It wasn't until the Nixon administration, so President Nixon allotted for Medicare to cover for dialysis, that dialysis even became available to most people. So before the 1970s, if you developed kidney failure, unless you were very, very wealthy or very connected, once you got kidney failure, you just died. So if you think about it, then what's the point in really kind of working and diagnosing and dealing with kidney failure if there was really no treatment available to you? But again, now we have more testing, we have more knowledge, and so we know more about kidney disease. I will say this. Again, the number one cause of kidney disease is diabetes. Number two cause is hypertension. One of the risk factors for both of these illnesses is obesity. And as a whole, as United States citizens, we are getting bigger and bigger, we're getting thicker and thicker. And so more of us have diabetes and hypertension. So from that aspect, that's a higher risk for kidney disease. And it really could be contributing to higher numbers.
Okay.
Thank you for your question, Ms. Inez.
To piggyback off the hypertension and diabetes, what are a good marker to look for when you go to your physician as far as level as diabetes? My sugar should be at this level, or blood pressure maintained at what level?
That's a good question. So for diabetes, when you get your routine blood testing, there's the blood glucose, which is another name for sugar. When that test is done and you've been fasting, so no food, no drink, nothing for at least 8 hours, a fasting blood sugar should be less than 126. It should be less than 126. If it is consistently greater than 126, then there is a very good chance that you have diabetes. An even more reliable test is something called the hemoglobin A1C. Hemoglobin A1C. That's a test that will not only get what your blood sugar is in a moment in time, it actually averages what your blood sugars have been for the last 3 months. So that's actually a more accurate test. You should request this from your primary care physician, because if your hemoglobin A1C is elevated, you could have diabetes, or if it's borderline, you may be at risk or pre-diabetic. Knowing that will help you to treat your blood sugars, have a low carb diet, low sugar diet, and decrease that risk factor from the kidney disease, which you don't want. That's a good question.
I've seen some questions previously from your other videos that, this recurrent exercise. Will exercise alone keep your blood pressure at a comfortable level, or if you have a history of high blood pressure in your family, are there other factors that you should take into account as well?
That's a very good question. So exercise, first of all, is a good thing. Most people should be exercising, doing some type of a cardiovascular activity for 30 minutes a day, most days of the week. What exercise does is, one, it helps to maintain a good weight control. And the less obesity you have, the less body fat, then the lower your blood pressure. Also, exercise can help to dilate your blood vessels. And when dilated, that's less pressure. So you can have a lower blood pressure with exercise. So definitely it helps. However, there are some people who are just genetically predisposed to having high blood pressure. They have what we call primary hypertension or essential hypertension. And so for those people, even if they're in shape, even if they're exercising, by all it's helpful and it won't hurt you, but you still may have to take blood pressure medicines. Other factors, salt. You can be exercising all day long, but if you have a high sodium, a high salt diet, you can still have high blood pressure. And then there are secondary causes of high blood pressure, meaning you can have disease states like hyperthyroidism that can cause a high blood pressure. You can have hypercortisol. You can have Crohn's disease, Cushing's disease. There are all kinds of things. So again, you must be seeing your primary care physician, even if you feel perfectly healthy, because you want to prevent and treat things like high blood pressure.
Okay, good answer.
Oh, thank you.
I know, I see patients with you in the clinic every week, and a lot of them ask me about their EGFR.
Mm-hmm. So that EGKD2, chronic kidney disease stage, something to really pay attention to. A paper may tell you that things are normal, but you have to talk to your doctor. For patients who have EGFRs that are between 30 and 60, those are the ones, if that's their persistent range, then those are the ones who have CKD3, chronic kidney disease 3. Here's the trick. Sometimes even your primary doctor may see that you are having a GFR that's less than 60, but if your creatinine, say, even if it's not less than 1.0, if it's like 1.2, 1.3, it may not set off an alarm in your doctor. You have to be your own advocate. Pay attention to your EGFR. And definitely, if it's less than 60, you want to bring that to the attention of your doctor, because if it is less than 60, then you should be seen by a kidney doctor. But the EGFR is somewhat of an estimation of your percent kidney function. Very important number. Let's see. So what else with the EGFR? If that EGFR is less than 15, then you are at CKD stage 5, chronic kidney disease stage 5. And that's the end stage renal disease. I was talking about that number earlier and how 700,000 Americans are in the end